Mr. Chairman, thank you very much. Mr. Chairman, since last September, I've been asking that this committee address the crisis in health care with regard to soaring prescription drug prices. This particular amendment cannot address all of the aspects of the crisis that is affecting one American family after another. Americans that are struggling to purchase life-saving medications are not getting the help that they need. This committee has the responsibility to address this problem, and as best I can determine in surveying the committee and all of its subcommittees since our request that the committee focus some attention on soaring prescription drug prices, the committee has done absolutely nothing. It has been silent. It has refused to consider the impact that the pharmaceutical industry is having in charging what are probably the world's highest prices for prescription drugs, in raising the cost of prescription drugs time and time again. And this is not just one type of prescription drug or one disease. It ranges from the hike that's been immense in the price of insulin that affects so many people with diabetes in the area that I represent in Texas. It affects the many people who cannot afford their drugs with regard to oncology and cancer treatment. It affects EpiPen. It affects just a wide range of prescription drugs that people cannot afford because the price is going up so greatly. The one response that we have had to prescription drugs, and the nearest thing we have had to a debate in this committee, is the decision of the committee, instead of addressing the prescription drug crisis, to reward the price gougers. And this committee approved legislation to give the pharmaceutical industry, and specifically name brand pharmaceuticals, otherwise known as Big Pharma, to give almost $30 billion in a tax windfall to that industry without asking for anything in return. So instead of responding to the problem with prescription drugs, this committee and the majority in the House approved legislation that gave pharma this huge tax windfall for nothing and asked for nothing in return to address the crisis. The bill before us today attempts to correct some of the shortcomings in the bill that the House and this committee approved. It's called the Veterans Equal Treatment Act, and while it doesn't provide veterans equal treatment, as we just discussed, it does provide some correction of the problem, that the deficiency in the original bill. I would suggest that this is an even greater deficiency. And so this bill offers an opportunity to attempt to correct the shortcoming of the bill that the committee approved and address this prescription problem. And it's directly related to this bill because under the legislation that was approved, the effect of taking the $29 billion and giving it to the pharmaceutical companies is to hike the premiums on Part B coverage. The money that came from this pharmaceutical tax went directly into a fund that helped keep the Part B premium under control. And so what I would do is to restore that. And if you don't restore it, you will see Part B premiums rise because the people that are paying Part B premiums who rely on their Medicare, they are going to be paying more because the pharmaceutical companies got a windfall. And our Part B and Part D policies are already deficient, but without this amendment, it will get worse. And I would just suggest that this gets to a matter that is really important to seniors who are relying on Medicare. We heard President Trump say no cuts to Medicare, no cuts to Medicaid, and that he would do something about soaring prescription drug prices. Frankly, I was heartened by that. I didn't agree with him on many other issues, but he finally said, we're going to take on Big Pharma. We're going to do something about this crisis, but the only bill he has endorsed to date, the only action he's endorsed to date, is to approve a $29 million windfall to the pharma folks. I would urge adoption of this amendment to correct one of the glaring inadequacies of the original proposal.
Thank you. All time has expired. Mr. T. Berry.
Mr. Chairman, I'd love to respond, but I think the better part of me thinks I should just make a point of order to the amendment because it's not germane to the amendment in the nature of a substitute. The amendment violates House Rule 16, Clause 7, because it introduces a new subject matter outside the narrow scope of the chairman's amendment, which pertains to veterans and the tax credit.
Thank you. Does the gentleman offering the amendment wish to speak on the point of order?
Thank you very much, Mr. Chairman. As I have commented in the questions to Mr. Barthold and in the comments on the underlying bill, many veterans are impacted by what we're doing here and will be impacted on the cost of prescription drugs. Of course, many veterans benefit from the Veterans Administration program where they can get their prescription drugs at an affordable price. What I would like to see in place is a measure similar to that so that the rest of Medicare beneficiaries can get their prescription drugs at an affordable price. But there are some veterans that don't qualify for that Veterans Administration program, and they get the brunt of prescription price gouging like everyone else. So I think this is a measure that is appropriate for this bill because of its impact on veterans, and it is appropriate because this bill before us, the Veterans Equal Treatment Act, is trying to correct one of the many deficiencies in the original repeal of the Affordable Care Act, and this is a glaring deficiency that demands correction. And it is the only opportunity, given your refusal, Mr. Chairman, to even conduct a hearing on prescription price gouging. It's the only opportunity we have to raise this issue and try to see that at least Part B premiums don't get hiked because the big pharma has received this unjustified windfall of $29 billion. And I thank you for the opportunity to comment on the point of order.
Thank you, Mr. Doggett. I am prepared to rule the amendment is not germane to the amendment in nature of substitute because it does violate House Rule 16, Clause 7 by introducing a new subject matter outside the scope of my amendment in the nature of a substitute, the excise tax on pharmaceuticals.
And Mr. Chairman, on that, I would appeal the ruling of the chair.
The point of order, sustain the amendment is not in order.
I move to table the
Mr. Doggett
appeal.
appeals the ruling. Mr. T. Berry moves the table. Questions on the motion to table the appeal of the chair's ruling. All those in favor signify by saying aye.
Aye.
Those opposed, no. No.
Mr.
In the opinion of the chair, the ayes have it. The motion
Mr. Chairman,
to
on
table
that, I
is agreed.
request a record vote.
The clerk, a recorded vote has been requested. The clerk will call the roll.